friends, this is Laura with Potpourri of Life. I hope that you're doing great. Today what I wanted to share with you is a little bit in reference to healthcare. I read it on Becker's Health It, and it comes from the Fortune report that I couldn't open up because I have to pay for it and I'm too frugal or cheap, however you want to perceive it. But this particular article shares enough where I can share it with you. Curious as to what your response is. But the title is Healthcare in 2024 is Just Kind of Nutty. And this is being quoted from Amazon CEO. Amazon CEO Andy Jassy said modern day healthcare is just kind of nutty, and future generations will look back on this time wondering, what were you thinking? I'm not sure they'll be saying that. They'll probably be like, how did that work? I don't know. Every generation is different, correct? He described the 2024 experience of making an appointment sometimes far in advance. We do that now. Driving to the physician's office. Yeah, we do that. Sitting in a series of waiting areas. I don't know what he means by a series of waiting rooms. You go to a clinician, like a well visit. You go to a waiting room, and you wait your turn to see the nurse who comes in, takes you to another room to take your vitals, and you wait there to see your doctor. Maybe in other areas it's different. Maybe you might have a third area. I don't know, but it's not that horrible. But you have to go through a cycle of things. It's not like you can go and all of a sudden your doctor's there. But maybe modern medicine is going to be transitioning where you see your doctor right away. But, telehealth visits, that's the way it is anyway. So to the physician's office, then sitting in a series of waiting rooms, seeing a clinician for a few minutes, then commuting to the pharmacy, according to yesterday's story. He said explaining it to his future grandchildren be aching to telling his children that we didn't always have cell phones. So he's comparing how if we tell our children that we didn't always have cell phones, we always had landlines, I still have a landline. I'm very happy with my landline. I rarely use my cell phone. I got to call my provider because it's like, I'm not using my cell phone. So that's beside the point. We're talking healthcare here. He says, my kids, his grandchildren, will not believe what the healthcare experience was for us. What a dilemma. Mr. Jassy told the news outlet at the recent Davos conference in Switzerland, that experience is just kind of nutty and will completely go away with the future of healthcare. That statement alone is kind of scary, in my opinion. And he believes his company will have a lot to do with the shaping of that future, according to the story. With One Medical, Amazon bought in 2023 for $3.9 billion, in Amazon Pharmacy, many patients can get treatment without leaving their home. You can do that with your primary care, and you can do that with your specialist as of today. It's nothing new, but you'll be able to get future treatment without leaving your home via the virtual care and medication delivery. Okay, you might have to leave your home to go get your medication, but you can get it that day. And you can still have your medications delivered to you. It's just a matter of how you set it up. So this is nothing new, but he is promoting how this will make a transition. I believe the difference will be is you'll get to chat with some doctors. Let me finish reading this. One Medical has an amazing digital interface. You can chat with doctors and get same day or next day appointments. Mr. Jassy told Fortune, whatever pharmaceutical needs you have, they're connected to Amazon Pharmacy that you just get sent to your house within a day. And they talk about they're not sure if it's going to go the way of Haven Health or J.P. Morgan Chase and Berkshire Hathaway that had disbanded in 2021, or whether the Federal Trade Commission data privacy concerns over the deal will have an effect. That remains to be seen. So that's something to keep in mind. Our privacy is not as private as we all think it is. We do have HIPAA. Healthcare providers and those who work in it, like you could go to an office and there's a lot of people that see your medical record. And this is just par for the course. They also see everything you write and all that. But also, medical billing sees a lot of things. And I can share a little bit of that on another video, but so you get all this, but he's trying to make it out to be something better than what we have today. I know that if I need a virtual health appointment, I can call and schedule that. Okay, it won't be scheduled for today unless the doctor has the opening. In primary care, sometimes doctors and nurses, they're nurse practitioners, they all have openings throughout the day. Mondays are the worst day to get them because of the weekend and everybody waited, or most people waited, to try to get in. So you might be able to get some of those appointments because I think they're setting up so that you can do those. We don't call the doctors much, so that's not a big deal. Now, your specialty care, you're always booking in advance because that's just how it is. And from my experience, there's not enough doctors right now for specialty care or primary care. There just isn't. Mental health, there's not enough care out there. So where is it going? If everybody's in a hurry for healthcare and thinking that Amazon has the solution, just be very careful. If you've established good relationships with your care providers, don't jump ship yet. It might be a sinking ship on the other end. It's sort of like the grass is always greener on the other side, because sure, everything might look all nice, but you might not know what the hiccups could be. So be aware that your privacy concerns could be out for everybody to know. And we already deal with that because like in one healthcare, we got Cerner in one healthcare area in our town and we got Epic in another. And both of those are not centrally for the hospital. Other hospitals use them. And the reason that they use them is so that other hospitals, like say I'm here and I go to another facility out of state, they have a way of finding out what your history is. If you're in a car accident and can't say anything, your history should be able to tell them what your allergies are. So that's a good feature. I don't like it, but it is something that in the back of my mind thinking, it's actually not that horrible. I used to carry a list of allergies, surgeries, and all that. I don't have to do that anymore. I'm not sure if this is really going to be great. I find it interesting that he feels like he has the gold standard on healthcare. Healthcare is definitely changing. More than I'm comfortable with. I know that when our kids were young, yes, we go to see the doctor. You could be in the waiting room for an hour, and then it might be, 15 minutes before the doctor could come in because he might be finishing up with the patient before. That happens. And it's kind of exhausting while you're waiting. But in most cases, they're trying to schedule so that doesn't happen. And I think as long as we are happy with our health care providers, we need to be aware that this is a good thing to stay connected with who you have taking care of you. Now, there will be some instances where it's like you can't get in, so you don't want to go down to the emergency centers and stuff like that. I'm not talking about the ER. We don't tend to go to them. But like our insurance, if we need to go to an urgent care, it costs us $200 right then and there. If we go to the ER, we're talking, I think, $500 or $600, unless we get admitted. Trust me, David and I have said, we'll die first. No, we're not going to die first. We will do everything in our power to make sure we don't need that type of care. And, I've been referred to urgent care before by a primary care years ago and another doctor once. And, I just won't do it. If they don't have the time for me, and the one time I did go, they did tests that my doctor did not request. And so I'm just like, no, they make up their own decision. When I called them and said, hey, I'm not paying for that test. And they said, well, we have to do these things. I said, no, you need to tell me. So be verbal, be your own advocate, and don't allow them to take tests that you're not aware of, because you should not have to pay for something that you know nothing about. So keep those communication lines open. How do I feel about this? I'm not sure it's a good thing. I mean, Amazon will do whatever Amazon will do. I'm not ditching Amazon. I mean, we do purchase some things from Amazon. We're doing less and less and less as we find out who these vendors are. We're trying to shop directly with the vendors that we like their product, because we find that keeping the businesses open here in the United States is important to us. And I realize other people might not think so. But when it comes to healthcare, I'm not sure if I want to get onto Amazon and talk to a doctor, I don't know. I haven't established a relationship, so I don't know them. If I need to call back, I might not get them. It's sort of like calling your insurance company. First of all, you don't know where they're located, and you don't know who they are, and if you call back, you don't get a direct line to talk to them. You get the next person in line. I'm not sure if I see healthcare going that way, but I'm not sure if it's a good thing. And as healthcare changes, yes, we have to adapt, but I also think that we don't have to let it go that far if we're willing to work with the systems that are currently in place. I'm not saying they're great, because I see a lot of flaws that have come as a result of COVID. And it does make both my husband and I stop and think, what are we doing? And we don't go to the doctors very often. And we're kind of happy about that. I've been slowly removing certain things out of my care and just taking care of myself at home. So I'm curious as to what your thoughts are on this. Do you think Amazon can do justice for our healthcare? You might think it would. It might be great for somebody who doesn't see the doctor but maybe once every 4 or 5 years. That might work out perfect for you. Before you see those care providers, though, you're going to have to do your own due diligence and check with your insurance company to make sure that they are covered. Because your insurance company might not cover them. And they also might not cover, even in today, and I can share this in another video, you might have a physician who works in an area that is totally covered. But if he works in another state or something like that, he might not be covered under your plan. And doctors have different license numbers. And so they have to use those in order for you to be covered. You can get confirmation before you talk to them to make sure that they're covered. But I would not trust you getting on the phone and saying, yes, we are covered by your insurance company. Can they confirm that? How do we know that that's true? Because if they are not covered, you have to pay for that. Now, if you don't have insurance, that'll be okay. And remember, Amazon won't care. They already have your credit card on file. They'll charge you. So I don't trust that system. We need to be able to get care that we feel confident in the provider, establish a relationship. And in some care, like family care situations, you might have your doctor, but you might have a nurse practitioner, and you might have your an RN that might be working with you. So you have a little bit of a team. And you usually know that if you're calling in, you need to be seen that day. You might not see your doctor. You might see a nurse who is working with that physician. But I'm sharing this because I'm actually concerned. I'm not worried because I will not use an Amazon doctor. I don't think it's appropriate. And this is just my viewpoint. I just found this to be a little bit wonky. And so I'm curious as to what your thoughts are. Are you willing to shop with Amazon doctors at this point? I realize some people are getting their medications on Amazon, and I don't personally like to buy supplements or anything like that off Amazon. And there is a reason, and many people do not know, is that companies across the oceans can copy things, and people can do this all over the time. Even in the States, they can copy packaging, they can copy pictures, they can do all this and make it seem like you're getting the same thing, when in fact you might not be. I would rather work with a pharmacy locally than with somebody from another place. And I think Amazon, for getting us things that we need right away, or different stuff like that we're working with, I think it's a great source. I think Amazon has its place. But in healthcare, I don't agree. I am curious as to what your thoughts are on this. And, but I hope more importantly that you're staying healthy and that you're taking care of yourself so you don't have to see the docs. Folks, have a great night, and may God bless you.